Future. Well, the future for me, I think, is just so exciting. I've having been in digital now for 25 years, nothing holds as much promise, I believe, as this new concept of conversational solutions. Because ultimately, the bot that you are speaking to quickly becomes an expert. And the level of expertise in that bot can be mind-boggling, because literally that bot can have reviewed every single patient chart ever. You know this, right?
Yeah.
It can have reviewed every clinical study. It can have included every product monograph. The kind of clinical capability is beyond any individual physician. So the capability or the future of taking that, tapping into that intelligence and that expertise, and then capturing it and now scaling it to patients is mind-boggling, right? I mean, there's a huge fear though in that, of course, because what does the doctor do? Right?
Yeah.
And that's the biggest question. And of course, I think that information or education, this content without the kind of the empathy and the insights and the personal nature of relationship that you have with a healthcare professional don't mean as much, right?
Yeah.
And so that I think is the big challenge, and the exciting part for me is how do we bring those together?
Yeah.
How do we bring the expert that lives within the bot, right, that is deployed through and scaled through conversational solutions, and how do we marry that with the healthcare system that's so much based upon the personal nature and interaction that's needed to drive outcomes, right? I think we heard a lot about that this morning about empathy, the power of empathy and the power of understanding your patient. I'm not sure if bots are going to get there that quickly.
Yeah,
okay.
That's really interesting, and I guess for us, it's sort of something that yes, that we're totally excited by the kind of potential of what technology can do. And you touched on it earlier on. One of the big areas for us moving forward has been this kind of growth in platforms. So a lot of people coming to us interested in developing, a platform rather than an individual product. You talked a bit about your previous experience about a lot of them have lots of different disconnected kind of parts of the puzzle, but no way of bringing it all together. So I think for us, one of the exciting things is the opportunity to find the right partner to develop some of those platforms, and who knows, maybe the conversational part sort of is a big plug-in, a big part of that also. So it's interesting.
I think you've nailed it, because they are separate. The platform and the conversations are somewhat or completely distinct in some way. And so when you do have a database of conversations, we can deploy those as a conversation as a service model. Any bot can actually tap into our conversations, but the platform layer and the AI layer are also absolutely critical parts, right? I think that where companies like ourselves or agencies like ourselves focus on is how do you make those conversations magical? How do you humanize them? How do you make them engaging? Just as a side note, one of the key things that we've learned over the last year, not surprising, I guess, if you look back at, is that patients would rather interact with a bot than with a human.
Right.
Healthcare is such a personal experience, fraught with embarrassment, judgment, stigma, this whole plethora of emotional things surround your healthcare experience. And so they'd rather actually talk to a bot, especially when you get into, I think, conditions that are extremely stigmatized, depression, where people just won't talk to other people about it, even their best friends. And what we find is that they'll actually ask bots those questions, which very quickly starts to build that database of what are the true emotional questions that patients have about their conditions, because we don't know. Like, what is that really, what is it that cause patients, or what keeps a patient up at night, right? It's typically not dosing, science-based questions. It's typically emotional questions. Will I ever go back to the life I had before? Things that are really important to them. I think that's one of the things that we've learned very quickly. I think that'll be part of the journey over the next year for us, is really diving into what do patients want. And it's not that much different for doctors either, right? Doctors have a very large set of questions. We just don't know what they are, right? And sometimes they're very simple questions, right? So I think over the next little while we'll discover that, and I think you guys will get that as well, right?